The Coalition of Health Experts is backing a national plan to improve ventilation in classrooms, workplaces and indoor venues when lockdowns end. Joining us live for more on this is Lidia Morawska, Distinguished Professor in the School of Earth and Atmospheric Sciences at the Queensland University of Technology and also member of the relatively new expert group AusSage. Appreciate your time. Tell us how we should be doing that. It does sound like a pretty expensive task to improve ventilation right across all of our schools and workplaces.
Well, it may be seen expensive, but on the other hand, it's long overdue. In some cases, it's quite simple. In some cases, it's just open the window, open the door, and the ventilation will improve. In some cases, it may not be possible at all if there are no windows and the place is naturally ventilated. In such cases, the only way to ensure that the virus is removed from the space is by using air purifiers. But this is important. It's important, and the pandemic cost us a lot, and the cost of improving ventilation is relatively low compared to the other costs of the pandemic.
And when you look at schools in particular, I know this has been a big debate we've seen raging overseas, particularly in the United States. What do those studies tell us from overseas about how ventilation has actually decreased the spread of COVID in that particular sort of school setting environment?
There have been a number of studies showing schools which had improved ventilation had fewer cases. Of course, it's difficult to do studies like this during the pandemic, and particularly when they've been locked down where schools were closed. In the United States, for example, schools in many states were closed and kids were not at the schools. So this is not necessarily the best time to check what's the impact of the ventilation. But nevertheless, the basic science is very clear about this. The virus is emitted from our nose, our mouth, and in the first instance is in the air. If it stays in the air, in poorly ventilated places, others inhale it and get infected. Therefore, it has to be removed from the air to prevent infections.
So for people watching this interview at home and thinking about their own household situation, what are your tips for people, first of all, to find out what sort of levels of ventilation they have in their own home, and secondly, some of the easy ways that they can improve that? You mentioned opening up a window as an easy way to do that, but what are your tips for the average person wanting to improve ventilation?
Well, indeed, the first point is to check what the situation is, or whether there is ventilation or not. And I can guarantee if a house is naturally ventilated, doesn't have any mechanical means of turning the air, and if everything is closed, ventilation is very low. It's just ventilation through any existing holes or leakages in the building envelope. So it's very low ventilation. So windows have to stay open to ensure ventilation. Now, how would we know whether there's enough ventilation? In many cases, we can't tell. We still need to measure it using, for example, carbon dioxide meters. And this would tell us, is the place sufficiently well ventilated or not? If not, we then need to see what else we can do to basically increase airflow.